Welcome to today's episode. We're diving into the life and work of a medical pioneer, Ernest Amory Codman. He was a surgeon who did something pretty bold for his time. He turned his focus to healthcare transparency, even if it meant facing some pretty uncomfortable truths about mistakes and failures.
Yeah, and what's fascinating is how ahead of his time he was. Codman didn't just aim for surgical precision. He was all about improving healthcare by being brutally honest about errors. Imagine reporting every mistake, every failure in your work, and publishing it for the world to see.
That's exactly what he did. Codman took a radical approach by systematically tracking the results of surgeries, good or bad, and making sure that the mistakes were openly acknowledged. He founded his own hospital just to make sure he could implement his philosophy without the pressure of traditional hospital systems.
It's almost like he wanted to turn medicine into something more accountable. Instead of hiding failures, he thought they were the key to real progress. And let's not forget, this wasn't just about individual patients. He wanted the whole medical community to be more open too.
Definitely. He believed that in order to truly improve healthcare, they needed to analyze and learn from mistakes. The medical community was so focused on celebrating the successes, but Codman said, no, it's the failures that are the gold mine. It's all about understanding where things went wrong and how to fix them.
And he wasn't just preaching theory. He published his findings, including the mistakes, in annual reports. He even sent those reports to other hospitals, challenging them to do the same. That's pretty radical, especially back in the early 1900s.
It was like he was poking at the whole healthcare system and saying, you can't just sweep things under the rug. Be honest with your patients and the public. He even critiqued his own work publicly, which was such a bold move for someone in his position.
Speaking of which, his famous cartoon, the one where he depicted doctors as greedy and corrupt, really stirred things up. In it, he showed a doctor as an ostrich, burying its head in the sand to avoid the truth. Codman was showing the public what he saw as the medical community's reluctance to face the hard facts about care outcomes.
Yeah, and what's striking is that it wasn't just about doctors being unethical, it was about the system being so focused on profit that transparency was secondary. Codman wanted to pull the curtain back, expose the truth, and force change.
His message was clear: stop hiding behind the veil of perfection. Even if it meant sacrificing your own career or reputation, you should be honest and transparent. If patients knew the real quality of care they were getting, would they still come? That's a tough question to ask, but it's one he wanted people to think about.
And that honesty came at a price for Codman. He faced a lot of backlash for his ideas. He was essentially exiled from the established medical community for his views, but that didn't stop him from pushing forward. His financial and personal sacrifices just added to the tragedy of his story.
It's almost poetic that he became a martyr for quality in healthcare. His career took a major hit, but he never stopped advocating for reform. His work wasn't just about improving surgery, it was about rethinking the entire approach to patient care.
And while he might have been sidelined in his time, we're now beginning to realize the power of his ideas. Today, accountability and transparency are central to the healthcare reform we talk about. Codman's vision is finally catching up to us.
Absolutely. Codman's insistence on measuring and reporting errors might have been uncomfortable, but it set the stage for modern-day quality control in healthcare. It's crazy to think about how much he was willing to sacrifice for something that, at the time, seemed almost impossible.
So, as we wrap up, here's something to think about. If Codman were alive today, do you think he'd be satisfied with the progress we've made in healthcare transparency, or would he still be pushing us to do more?
I'm guessing he'd be pleased with some of the improvements, but he'd probably be challenging us to go even further. There's always room to be more honest, more accountable. If anything, Codman's legacy reminds us that we're never done with the fight for better care.
Well said. Thanks for tuning in today, and remember, sometimes facing the hard truths is the only way to get real progress.